Fascia is like a silver coating material that wraps around your muscles, your bone, your nerves, your organs. Actually, it's all over our body, and it interconnects all our muscles, and so it's a form of connective tissue. And we're trying to make sure those connective tissues are gliding and sliding. And sometimes if there's some restriction in that part of your body, it prevents you from having proper mobility and torquing your body in a different way. So right now we're trying to loosen up your tissue near your QL. It's a muscle called QL, or quadratus lumborum. It connects to the lower part of your ribs and to the upper part of your pelvis, which I'm going to show you a diagram in the video. So in this, I just roll side to side, more lateral, kind of loosen up those tissue, and then so I'll do like probably 90 seconds to 2 minutes just to break it up. And you might feel some tender spot. You don't have to go directly in those tender spots, just around that area. And if it's too unbearable, so you could also do this on the wall. And if it's too much laying down, because right now my body weight's it's on the ball, so then I'm gonna move this ball to my gluteus medius side of the butt, and there's a connective tissues there that I'm trying to lengthen. So I could go along the grain of the tissue. So I feel it's a little bit tender right now because I just had a bike ride this morning, 35-mile bike ride, so it was a little bit tight. So then I'll do more shearing, so it's not just along the grain now, it's more cross fiber, or I'll just do a sustained pressure. So that's another one. So I'll do all three just to kind of loosen up that tissue. And one area I'm trying to lengthen too is one of my hip flexors. It's called the tensor fascial, somewhere in here, diagonal to the leg. So I'm gonna face down and roll that. So not directly over the IT band, but more slightly in the corner between the muscle and the connective tissue. So I'll go up and down, roll it. So some of us, if it's too unbearable, you could, again, as I said, you could start this in the wall. Okay. And just go maybe 1 inch up, 1 inch down. And for some of us, this would be quite painful. So I suggest you start loosening up the pressure by standing on a wall. Then I also want to stretch out my QL, not my QL, my psoas. So it's psoas is somewhere close to the groin. That's a powerful muscle that connects our upper body and lower body. And I'll just do a sustained pressure. I'll stay here for 90 seconds to 2 minutes. So once you feel like a 15% release of discomfort, that's a sign that it started to relax. Another area I try to stretch out is your sartorius. So I'll find it first, then I'll bend my knee, then extend my knee. so that will lengthen that. And it's also a hip flexor, which many people neglect to stretch. It's not comfortable to do this, but it's needed. But thanks so much for watching, and till next time, bye.